Hello, welcome to OASIS, Objective Assessment of Sickness in Neonates using Sonography. Today, using echocardiography, we look at normal heart and the heart with transfusion of great vessels. How does the heart normally look like? This is a normal baby, which I am going to show you the normal heart, and three important areas you need to look at. One is the parasternal long axis, short axis, and four chamber view. You can understand the anatomy of the chambers connecting to the vessels, which is normal, abnormal. Okay. So what I will do is parasternal long axis, as all of us know how to keep. This is the window. This is second intercostal space. I am keeping parallel to the sternum on the left side with a marker facing to the. I'll just keep this one. So the marker. Yeah. Can you see that? This is the. This is the. Yeah. Can you see that? You can see the right ventricle here, left ventricle here, the mitral valve, and the left atrium. You can see the aorta. This is aortic valve. This is going up. Can you see that? This normally, I'll just zoom, see. Normally what happens, the left ventricle is connected to the aorta, and you can see there's no bend. It's normally is going up. So this is the aortic valve. So this is what you see in the parasternal long axis. Are you clear? You can see this is the parasternal long axis, and this is very important view to diagnose transfusion of great vessels. In the previous echo, I was showing that normally left atrium connects to left ventricle and aorta going up. But here you can see left atrium, left ventricle, and then you can see the tube coming down. You can see here, and you can see two branches also. If you see carefully, there are two branches. That means left ventricle is connected to the pulmonary artery. Correct? So this is on parasternal long axis. This is same parasternal long axis. This is a color Doppler. You can see left atrium open, left ventricle, and you can here the left ventricle open to the pulmonary artery, and you can see there is right pulmonary artery, left pulmonary artery, and also the ductus. So there is a huge ductus, patent ductus arteriosus in addition to this. So this is on color Doppler parasternal long axis. Parasternal long axis, beautifully you can see two branches, right pulmonary artery, left ventricle opening to the pulmonary artery. This is the left atrium, this is the right ventricle. I keep short axis, I'll go to the parasternal short axis. See, can you see that? See, this parasternal short axis is telling what you're seeing in the center is the root of aorta. So this is the aorta, and what you see anterior to the aorta is the pulmonary artery. So I just increase the gaze. See, now you can see this is the tricuspid aortic valve. You can see, and then you can see also this is the right ventricle opening to the pulmonary artery, and you can see two branches here, right? This is the right branch and left branch of pulmonary artery. You can actually see the color there. See, can you see that? Two branches of pulmonary artery? Yes. Yeah. So, one left and right branch of pulmonary artery. So, I'll just show you. Yeah, both the branches you can appreciate now. Okay. This is normal anatomy on short axis view. Aorta, anterior to the aorta, you've got pulmonary artery, and pulmonary artery is branching, and it is connected to the right ventricle. So, this is normal anatomy you see. This is parasternal short axis on color Doppler. You can see here the right ventricle is connected to the aorta, and this is the pulmonary artery. You can see the branches of pulmonary artery. You can see right, you can see left, you can see, and then the ductus arteriosus. Means, so what you are seeing here is this is the pulmonary artery. Ideally, the aorta should be there, and pulmonary artery will come here. Now here the aorta area is taken up by the pulmonary artery, and it is branching right, left, and then ductus arteriosus. Right ventricle, instead of connecting to the pulmonary artery, it is connected to the aorta. You can see it is straight. Ideally, right ventricle, pulmonary artery and branches you can see, you have to see there. But this is how the short axis on parasternal. This is normal anatomy, 4-chamber view. I just tilt it, I'll open it to 5-chamber view. In 5-chamber, what happens? Left ventricle is open to the aorta. Can you see that? I'll just put color. See, the blue jet is coming. Okay, normally in 5-chamber view, 5-chamber view is nothing but 4-chamber view with aorta open. Can you see that? Aorta open. This is a 5-chamber view and it is normal. There is no branching you see. And still if you keep that opening, you can see that right ventricle open into the pulmonary artery. So now we will see what will happen, the same changes in transposition of great vessels. So this is a color Doppler on 4-chamber view. You can see the right atrium, right ventricle, left atrium, left ventricle, and you see there is a shunting across the atrial septum. So there is a atrial septal defect and you can see the shunting there. This is very important because TGA requires atrial septostomy in the event of there is no atrial septum defect, and if the ductus is also closing, is an emergency to do the atrial septostomy. But here you can see that naturally there is the big defect actually in the septum. This is again subcostal 4-chamber view, and you see here there is a defect. This is a interatrial septum, and you can see the defect there between the right atrium and left atrium. This is a 5-chamber view. You can see that the left ventricle is opened into pulmonary artery. Can you see that pulmonary artery? So this is a pulmonary trunk and 2 branches, right and left. So this is transposition of great vessels, dTGA, where left ventricle, instead of opening to the aorta, it is opening to the pulmonary artery. You can see the 2 divisions of pulmonary artery. So here you can see again the 5-chamber is, this is a 5-chamber view, and the left ventricle is opened. You can see 2 branches of pulmonary artery, and also you can see the ductus arteriosus. So this is a 5-chamber view on color Doppler. This is the arch view, and here you can see this is the descending aorta, and this is the ductus. So can you see that? The ductus is huge. Yes. Okay, this is on 2D echo, and then what I'll do is I'll just put the color there. This is on color Doppler. You can see same. This is the arch view, and see the ductus is connected to the descending aorta. You can see that this is arch view. So any neonate, if you suspect cyanotic heart disease, kindly do the segmental approach and get normal anatomy in your mind and see to that is there any abnormality. So 3 important views one should know is parasternal long axis, where left ventricle open into the pulmonary artery and you can see 2 branches. The other one is parasternal short axis, where the aorta will become anterior to the pulmonary artery. That you can see that pulmonary artery branching into 2 and aorta going straight. So that is on parasternal short axis. 4-chamber view, you should always look for the atrial septum defect and you should measure. This is very important. And another important view is the 5-chamber view, where you can see the left ventricle opening into the pulmonary artery instead of aorta. So as you appreciated here. So if you keep doing the normal anatomies, and if you see some variations, and if you see these things, then you can look at whether you are looking at transposition of great vessels. Always remember that structural heart disease should be ruled out by a cardiologist. And if you see any variations in your segmental approach, please call cardiologist. Thank you so much.